Clinical decision making is the main component of practicing paramedic professionals. It involves determining between differential and provisional diagnosis whilst remaining professional and giving appropriate responses to patients. Perona, Rahman and O'Meara, 2019, page 1. Completing these clinical decisions in a pre-hospital environment is what separates paramedics from other practicing health professionals. Paramedic officers can do this efficiently by completing courses through tertiary education formats, as well as maintaining their knowledge through reviewing forums and research. Perona, Rahman and O'Meara, 2019, page 1. This ensures they can provide the most appropriate care to their patients. To provide paramedics with guidelines for their practice, the Australian Health Practitioner Regulation Agency, AHPRA, have created domains which provide guidance for professional practice. These guidelines ensure both the practicing paramedic officer and the general members of the public are protected. Like most other healthcare professionals, making clinical decisions is essential for all practicing registered paramedic professionals. The ability to determine differential and provisional diagnosis to determine an effective treatment plan for the patient is critical for a paramedic. This specific ability is taught through tertiary education institutions. Universities such as the Queensland University of Technology, QUT, provide the pathway and knowledge for an advanced care 2 paramedic, also known as Bravo officers, whilst TAFEs provide the certificate for advanced care 1 paramedics, also known as Charlie officers. Meadley, Olazem, De Lorenzo, Broader and Martin, 2017, page 3. Whilst both are identified as appropriate levels of training for AHPRA, they provide different levels of knowledge to students. University students are provided with knowledge to determine what could be the underlying cause for a patient's presenting condition. Meadley, Olazem, De Lorenzo, Broader and Martin, 2017, page 3. This knowledge includes the pathophysiology of the body and how each body system works to maintain homeostasis. In addition, the knowledge being taught also involves understanding how a paramedic professional can effectively treat these patients presenting complaints. Meadley, Olazem, De Lorenzo, Broader and Martin, 2017, page 3. This knowledge is what allows paramedic professionals to make the clinical decision on how that patient is treated prior to their arrival to hospital or any other medical facility. Treating a patient in a pre-hospital environment is what created the paramedic profession. Clinical decision making is significantly important to the paramedic profession as well as to the patient being treated in a pre-hospital environment. Carter and Thomas, 2015, page 2. The clinical decisions that a paramedic makes regarding their patient's treatment affects the treatment they receive once they arrive to a hospital's emergency department. Without appropriate treatment, a patient can be left with life-changing injuries or permanent damage to their body. Carter and Thomas, 2015, page 2. The decisions about the best treatment plan arise from paramedics removing pertinent negatives from their differential diagnoses. Hence, professional paramedics must have the ability to effectively investigate a patient's signs and symptoms before deciding an appropriate treatment plan. Without any investigations, the patient cannot be treated appropriately, therefore increasing the risk of harm that the patient may receive. Carter and Thomas, 2015, page 2. Therefore, it is significantly important for each practicing paramedic professional to use their knowledge, problem-solving skills, and critical thinking before making any clinical decision. Dogani, 2018, page 5. This protects the patient from harm as well as the paramedic from losing their registration and their job. A paramedic's ability to make appropriate clinical decisions is aided by open communication with their partner and the patient. As the patient needs to provide consent and be aware of their treatment, it is important to inform them of any decisions the paramedic is making. Vermeer, Vanderlich and De Groot, 2015, page 4. As a clinical decision may need to be altered if a patient refuses or declines a certain type of treatment. In addition to communication with the patient, it is also extremely important for paramedic officers to have open communication with each other. It is this open communication that aids paramedic professionals in making an appropriate treatment that both officers agree upon. Vermeer, Vanderlich and De Groot, 2015, page 8. This ensures all differential diagnoses are ruled out and the most appropriate treatment plan is achieved. AHPRA is the organisation behind regulating paramedic professionals and ensuring all those within the paramedic profession have up-to-date training. This is achieved by each practicing paramedic professional abiding to the guidelines set out by AHPRA, as well as achieving all of the required continuing professional development CPD points. Wardle, Seibert, Broom, Steele and Adams, 2016, page 10. Completing CPD points allows paramedics to keep their training up to date in relation to clinical decision making and their performance as a paramedic professional. CPD points are obtained through mentoring of paramedic students from all levels, attending forums and completing online packages. These points must be provided to AHPRA to ensure each practicing paramedic professional can maintain their registration. Wardle, Seibert, Broom, Steele and Adams, 2016, page 10. This allows all professional paramedics to maintain their knowledge and remain informed of newer treatments being implemented. Without registration, it is illegal for any individual to practice as a paramedic and call themselves a paramedic within Australia. The guidelines provided from AHPRA ensures paramedics are given clear domains and codes of conduct to abide by. These guidelines are provided under 5 separate domains within the Professional Capabilities document. Each of the 5 domains covers different areas that are involved within the paramedic profession. Within the 5 domains, it is clearly identified a specific scope of practice that is used for all paramedics working within the pre-hospital environment. Paramedicine Board of Australia, 2018, page 2. To maintain registration, each paramedic must demonstrate each scope of practice whilst on shift. Clinical decision making falls under Domain 3 of Evidence-Based Practice and Professional Learning. This domain instructs paramedics to use their knowledge to make informed clinical decisions whilst using their abilities to problem solve and critical think. Paramedicine Board of Australia, 2018, page 6. It also encompasses the paramedic's ability to critically analyse and evaluate each vital sign and each body system to make an informed clinical decision. This information is then used to make the decision on how critical the patient is and whether they require urgent transportation to hospital or treatment. Paramedicine Board of Australia, 2018, page 6. Complying with this scope of practice ensures the paramedic maintains patient safety as well as their own and their partners. In conclusion, clinical decision making in a pre-hospital setting is what distinguishes the paramedic profession compared to other practicing health professionals such as doctors and nurses. The AHPRA administration have produced a scope of practice under 5 separate domains to give all practicing paramedic professionals a guideline for their clinical decision making and practice. It is within these guidelines and scope of practice that paramedics must use their problem-solving skills along with their critical thinking and pathophysiology to create an appropriate treatment plan for their patients. It is using these skills in a pre-hospital environment that created the paramedic profession.